Good morning, everybody. Today we are here to discuss related to one of the important topics, the full body checkup. What are the facts and what are the myths? When any celebrity dies, or if somebody dies in the family suddenly, whole family or whole society start moving towards the diagnostic center. And there comes the query regarding what health checkup I should go, so that I should be knowing whether I am having heart block or I am having any health related issue that has to be addressed by a cardiologist or a doctor. So I am making this video after seeing one patient whose sons and daughters were staying in US, and they have submitted their parents for the health evaluation, and they have undergone what we call as a platinum health checkup. And you are knowing the cost of the platinum health checkup in some of the corporate hospital, it is around 70,000. So it is a very big figure, and when I come across patient like this one, I thought I should give some facts what it makes if 70,000 has to be invested, whether it is a right way or wrong way. So let us understand what is the basic minimum before going for health checkup. So when you are going for health checkups through the diagnostic or by the packages which has been offered, it is first and the foremost thing that you have to do, you have to own a doctor. I am using the word own a doctor means you have to go to a doctor and you have to discuss your health related problems, your risk factor, your family background, and what type of habits you are having, because that will give the impression what are the risk factors you are having and which has to be seen, what are the complaints which has to be evaluated, and in that light we have to give the battery of tests which will make difference, which will make diagnosis of a particular disease if you are having or not. So owning a doctor is a very important thing. If you are going like a package, it is like a diabetic package, or it is you are going for the cardiac evaluation package, that is not going to make a difference when it comes to the centers, because they will say we are giving a health package for the cardiac evaluation. But unless the doctor who has advised you that these are the tests, most of the tests what you are doing may not make much difference. So owning a doctor is a first and foremost thing, and in that you have to go a general physician or person who sees the patient in a holistic way. So it may be a family physician, it may be a general physician, it may be a cardiologist also who goes and see all the patient's complaints and then it advise you the investigations. And what are the minimum investigation that we should go if I am a healthy person being 35 crossed or maybe 30 crossed and I am not having any health related problem, or in my family, what are the basic minimum tests that we should undergo, and that will make some insight that whether I am having a heart related problem or not. So there are 4 or 5 tests we can say that is basic minimum, in which the hemogram that tells how our hemoglobin levels are. Then second come the serum creatinine that gives the impression about the renal function. Then liver function test, your lipid profile, finally your fasting, postprandial and hemoglobin 1AC. And there are some tests we do routinely, that is a ECG and echocardiography. So ECG gives regarding the electrical, how is your electrical issue of the heart, and finally the echo gives the structural aspect of the heart, means how your valves are functioning. If a person is sedentary, then it is mandatory that he should go for the TMT that gives the cardiac impression about his efficiency and how the heart is behaving when it is being stressed, means when you are walking or running, how much oxygen heart is able to draw, and any ischemia, means oxygen related issue or block related issue is cropping up or not. So these are the facts that we can get by doing the basic minimum test, and there needs one important thing to differentiate what is called signal versus noise. So some health related indicators what we are investigating that will certainly give a direction, particularly for a disease or condition. But there are a lot of information are there when you are going for the health packages which are not going to give you any direction. So sometimes the persons come with their blood evaluation and they say, sir, I am having this abnormal, what disease I am having. So that's why it becomes, those information is pointed to a disease versus it is a noise, we have to differentiate. Like if a person is having a normal hemoglobin and he is chasing serum iron level in absence of or without evaluation of serum ferritin, means we are not in the direction. So if a person is having low hemoglobin, the first and foremost investigation comes the serum ferritin, and then comes the serum iron. So if you are doing a serum iron level without serum ferritin, it doesn't give any direction, and that's why owning a doctor makes a difference. He will advise you the right set of the tests, and he can give the right answer why you are having the low hemoglobin. And that's why I impress, never ever go directly for the investigation per se. You should always own a doctor, and what he advises you should do. The second question arises when some celebrities die, that whether I am having block or not, and how I am going to know whether my investigation, any investigation is there which can tell me that I am having heart block. Heart block means coronary blocks. So if you really want to know the answer is coronary angiography is the only test which gives the information regarding the heart block, means heart coronaries having some blocks. There is no other investigation other than the one CT angio. So these are the two. CT angio means coronary angiography, what we do normally by the CT scan. So CT angio will be giving the same information what we do as an invasive coronary angiography, which we do by the radial or by the femoral routes. So there are two methods. One is the angiography, which we do in the cath lab after admitting the patients on the daily daycare basis, giving the dye directly in the coronary, and those things will give that whether the blocks are there or not. And second comes CT angio, in which we are giving the dye into the body through the peripheral route, and this is done under the CT scan. And CT scan makes the picture of the coronaries, how they are and where blocks are there or not. So these are two investigations which gives the full impression about the coronary blocks are there or not. But there are some indirect, like treadmill test which we do. So treadmill give indirect information whether your coronary is having block or not. So if you are doing an exercise and when you are running, heart is needing more oxygen. So if any blocks are coming, ECG will be getting abnormalities, and those ECG abnormalities will be taken as a marker of your coronary block. So that's why if you are a very sedentary person, it is one of the tests that may guide that you are having block or not. So this was related to the what we call as a coronary block or angiography. But a question arises, if my ECG, echo, TMT and even the angiography is normal, that means that I am not having heart attack, or I will not going to get any heart attack in the near future or future? And the answer is no. So when we are doing this test, we are giving an impression that everything is right now fine. It is your habit, it is your genetics, and it is the things of the disease per se, which is maybe indolent or maybe hidden. It may later on come in a full-blown illness like heart block, or we can say the plaque which may not be visible in the angiography. It may erupt like a crater which is start bleeding, or you can say that it convert into the blocks in one particular coronary artery, and you may develop the heart attack. So these tests only give the impression that at that particular time when we are doing either the angiography, TMT, echo, these all are normal. But even though if your test has been negative, or you can say nothing blocks has been there, it does not give a full proof, what you call assurity that you will not develop any coronary issues in the future, or you are not going to develop the heart attack in the future. And what is the most important thing on which this whole studies are going? It was the Framingham study that we are risk profiling the persons, and depending upon that risk profiling, we give some medicines and the lifestyle modification. The fact regarding this, all the packages, if you really want to know what is the truth behind it, I will recommend all of you to go and read about one of the recently published study, that was a Den-Kevas study. So it has been done almost of 46,000 patients, and these patients has been divided in two groups. One has comprehensively checked for the coronary, or you can say the block related issue by the different investigation, from the angiography to the ECG, echo, everything. and some are has been only kept on the healthcare management, we can say lifestyle modification. And the fact is very means fascinating, or you can say it is not very good for the health packages patient. It doesn't give any edge that if you are going for a comprehensive checkup, your life is going to be prolonged. There is no difference. So it is a 5-year data on the 5-year follow-up of intensive versus routine lifestyle modification. There was no difference in the death rate. So with this information, I think we should stick to our habits, and screening is must. If anybody is crossing 35 year, he should know his diabetic, hypertensive as well as the other risk marker, and it should always in discussion with the doctor. They should give the advice what are the investigations. And finally, and the foremost and the most important thing, never ever totally rely or never ever totally rely with Dr. Google. That will not lead you to any direction. You will be collecting more noise than the signals for your heart disease. So own a doctor and go by his advice and discuss regarding your health related issue with him. Thank you so much. See you next time. Jai Hind.